Hi guys, you are welcome to my channel, Natural Health. Please don't forget to like, subscribe to my channel and comment, this will assist me to work on my next video. Stay tuned and watch till the end. Welcome back. In today's video I will be talking about heart disease. Type of heart disease. Symptoms of heart disease. Let's get started. What is heart disease? When talking about heart conditions, doctors use the terms coronary heart disease, CHD, and the broader cardiovascular disease, CVD. CHD is used for any condition that affects heart function. CVD refers to both coronary heart disease and diseases of the circulation, such as stroke, when a clot blocks blood supply to the brain. Stroke is the country's third biggest killer, claiming 70,000 lives each year. 1. Most doctors now prefer to use the term CVD because it's the major cause of premature death in the UK, causing around 32% of premature deaths in men and 28% in women. Types of heart disease. There are a number of different types of heart disease. Irregular heartbeats, arrhythmia. Your heart contains a natural pacemaker called the sinoatrial or sinus node that triggers electrical impulses to spread over the heart, causing it to contract, beat. Any abnormal rhythm of the heartbeat is known as an arrhythmia. Common causes include electrical impulses coming from other areas of the heart instead of the sinus node that regulates heartbeat. Electrical impulses coming from the sinus node but that take a different pathway through the heart. A very fast heart rate, with either a regular or irregular rhythm. A combination of a regular and irregular heart rhythm. Cardiomyopathy. Cardiomyopathy means a disease of the heart muscle rather than the blood supply or the pacemaker. There is often no obvious cause for it, although coronary heart disease and high blood pressure, viral infections, excessive alcohol intake and thyroid disease can all be triggers. There are four main types. Ectopic cardiomyopathy, MCM, where the heart muscle thickens, high blood pressure can cause this. Dilated cardiomyopathy, DCM, when the heart muscle dilates, becomes large, and weakens. Restrictive cardiomyopathy, RCM, when chambers in the heart stiffen and restrict blood flow through the heart. Heart failure. Although it sounds frightening, heart failure simply means the heart is less efficient at pumping blood around the body than it used to be. The most common cause is a heart attack, but anything that puts extra strain on the heart can result in a degree of heart failure, such as high blood pressure or a cardiomyopathy. What are the symptoms of heart disease? One of the problems here is that people with quite advanced heart disease can have few, if any, symptoms. The first sign that anything is wrong happens when they have a cardiac event such as a heart attack or stroke. But for most people there are early signs and symptoms that point the way to the diagnosis. Sex. Men are more at risk than women and usually have heart attacks at an earlier age. However, the number of women with heart disease progressively increases after the menopause. A family history of heart disease. If you have parents with heart disease, you are more likely to have heart disease yourself. Ethnic origin. Some races, such as Afro-Caribbeans and some Asian communities, are more prone to coronary heart disease and stroke. Smokers are twice as likely to suffer heart attacks as non-smokers, and are more likely to die as a result. It is the nicotine and carbon monoxide in tobacco smoke that causes damage to the cardiovascular system. Alcohol. Regularly drinking more than 1 drink a day for women or more than 2 drinks a day for men increases the risk of heart disease. This is linked to a rise in blood pressure, obesity, and the effect of heavy drinking on levels of triglycerides in the blood, a type of fat. Binge drinking appears to be particularly dangerous here, even in younger people. Use. Cocaine abuse is well known for causing heart problems, such as fatal pacemaker irregularities, especially if alcohol is taken at the same time. High cholesterol levels. Cholesterol is a type of fat. The higher the cholesterol level in your blood, the higher the risk of coronary heart disease. When combined with other risk factors like smoking, the risk increases substantially. High blood pressure. Hypertension. High blood pressure increases the heart's workload, causing it to enlarge and weaken over time. When combined with obesity, smoking, high cholesterol or diabetes, the risk increases several times. Diabetes. People with diabetes have a far greater likelihood of developing cardiovascular disease compared to the general population, even if their sugar levels are well controlled. More than 80% of people with diabetes die of some form of heart or blood vessel disease. Heart disease treated. There are a number of treatments available for heart disease. Drug treatments. There are a wide variety of modern drug treatments for heart disease, including the following: angiotensin converting enzyme, ACE, inhibitors such as ramipril and lisinopril control high blood pressure and help protect the heart. Angiotensin II receptor antagonists or blockers, ARBs, also lower blood pressure. Some research now suggests this type of drug may have fewer side effects than ACE inhibitors, but this is still under review. Antiarrhythmic drugs help to control problems with the heart's rhythm. They include amiodarone, flecainide, mainly used for serious pacemaker problems, propafenone, and the old-fashioned drug digoxin, which is still the usual treatment for atrial fibrillation. Aspirin and antiplatelet drugs such as clopidogrel help reduce the stickiness of blood and so prevent blood clotting in the arteries. Beta blockers are commonly prescribed in the treatment of angina, high blood pressure, and heart failure. They allow the heart to slow down and not work so hard. These are sometimes used in conjunction with diuretics or water tablets to control blood pressure or remove excess fluid from the body. Thank you for watching. Please, if this video is beneficial to you, please don't forget to subscribe and click the like button, comment.